My name is Rehan Syed, and this is my presentation on gene editing sickle cell, a global dilemma. Essentially, over this presentation, I'll be describing what sickle cell anemia is, what CRISPR is in means of gene editing, and how CRISPR has been used to reduce the symptoms of sickle cell anemia. But first, let me give you an introduction to who I am and what my passions are. I'm a rising junior at Vista del Lago High School in Folsom, California. I'm community driven as I'm an escort volunteer at Sacramento's Veterans Hospital in Matherfield. I'm a part of clubs like the American Red Cross as I volunteer there, the Neuroscience Club, the Muslim Student Association Club, the Future Health Professionals Club, but most importantly, I'm proud of being the treasurer of the Children's Cancer Association Club. I'm academically focused, completing classes at my local community college in topics like medicine, mathematics, and biology, and maintain high grades in my classes. Some of my passions include being fascinated by human bones and anatomy. I do aspire to be an orthopedic doctor, and I'm a volleyball enjoyer, and I'm a part of my school's volleyball team. So here's a little bit of an introduction to the sickle cell disease and what it is. Sickle cell disease is a genetic mutation of the red blood cell which causes them to be a crescent/sickle cell shape. You can see here the normal red blood cell looks like a circle on the right. But you can also see, due to the sickle cell disease, red blood cells kind of look like a sickle, which is why they are called the sickle cell disease. These misshapen blood cells block blood flow and can lead to many hazardous health issues like strokes, infections, or organ damage, but they can moreover lead to death if left untreated. It mainly affects people of African, Mediterranean, and Middle Eastern descent. Now let's lead to what is CRISPR, and will later lead to how CRISPR can reduce the symptoms of sickle cell anemia. CRISPR stands for clustered regularly interspaced short palindromic repeats, but essentially it's a tool used to change the DNA of living cells. It was adapted from natural bacteria to protect themselves by cutting parts of DNA with viruses or mutations. These viruses or mutations can apply to the sickle cell anemia, which is why CRISPR can be applied to sickle cell anemia and reduce the symptoms of it. It allows scientists to meticulously modify genes and DNA, making it a useful and powerful tool for treating diseases. As you can see, the images to our left can show the CRISPR molecule as it targets a specific portion of a DNA, and once it finds a precise location of the target DNA, it then the CRISPR enzyme cuts into the target DNA, and afterward it creates a custom sequence which can be added to the DNA, and it would repair the DNA overall. So that's essentially how CRISPR works and how it can be applied to the sickle cell anemia in order to reduce its symptoms. So how gene editing treats sickle cell disease. CRISPR can be used to edit the gene of a person with the sickle cell disease, enabling their body to produce healthy red blood cells instead of sickle blood cells. Scientists have discovered that a gene known as the BCL11A turns off fetal hemoglobin after birth, but that doesn't cause the sickle cell disease itself. Using CRISPR and Cas9, scientists have found out that how to turn off the BCL11A and reactivate fetal hemoglobin, which allows the body to produce and create red blood cell, which it regularly needs. This breakthrough, known as Casgevy, an FDA-approved gene editing treatment for the sickle cell disease, has led to effective treatment which reduces the pain of the sickle cell disease. For example, a person known as Victoria Gray was one of the first people to be treated using CRISPR for the sickle cell disease, and it effectively worked. A life-saving therapy few that can afford. CRISPR treatment like Casgevy costs $2.2 million per patient, which is extremely expensive. Many impoverished and third world countries lacking funding, medical infrastructure, and staff to obtain or afford the treatment. So they lack everything, a lot of things, to obtain or even afford treatment. This creates a major inequality where those who live in wealthy nations or who are wealthy can only receive treatment. And this image to our left essentially shows births with sickle cell anemia per 100,000 births. And we can effectively see here that many people in the sub-Saharan parts of Africa are born with the sickle cell trait and will later be affected by it. And you can also see areas in India and the Mediterranean have been affected as well. in the Middle East. So here's a little bit of an infographic on expected years of life remaining by age in the US, not in Africa or any other parts of the world, specifically to the US, which many people of the African American descent inhabit. So you can see here the US population in 2006 has a high life expectancy, as well as the total Black population in the US has also high life expectancy, a little bit lower than the US total average. But many people with the sickle cell disease who happen to be of the African American descent have a lower expectancy of life due to the disease, showing how the disease needs to be taken care of and a cure for the disease to reduce the symptoms is effectively needed. So this is my call to action. There should be a global distribution of gene editing care, ensuring CRISPR benefits help those in impoverished and vulnerable countries. CRISPR therapies should be made affordable through financial aid programs to help those with low incomes. Investments into healthcare infrastructure and training in impoverished areas is needed in order to give gene editing treatment for everyone, even those who live in very wealthy areas but who have low incomes or live in very poor countries, third world countries. And this image to our right essentially shows everyone coming together in order to listen to this call of action and help those who have the sickle cell anemia and get CRISPR treatment to those who have it. So that is the end of my presentation. For my acknowledgements, I want to thank the GHLC team for giving me the opportunity to give you this presentation. I also thank you, the audience, for watching. I hope you spread awareness, support access to CRISPR to all, and contribute to this cause. So here's my works cited. I use many different works cited and many sources as well. And lastly, my name is Rehan Syed. My email is rehansayednumer@gmail.com if you have any questions, and I hope you enjoyed listening to this presentation.